Hi friends, today I will tell you the management of a patient with ARDS. The inclusive criteria of ARDS is patient PF ratio is less than and equal than 300. You can calculate the PF ratio by dividing the PaO2 on FiO2. Secondly, patient must have bilateral infiltrates in chest x-rays with non-cardiogenic pulmonary edema. Thirdly, no clinical evidence of left atrial hypertension. Now move toward the management of a patient with ARDS. Being a nurse, it is very necessary for us to know the goals of a patient with ARDS. First goal is predicted body weight. You must calculate the patient predicted body weight, and you can calculate it by using these formulas. So here is a different formula for male and different for female. Secondly, you set the patient ideal volume as low as 6 ml per kg according to the predictive body weight. Thirdly, the target goal of your plateau pressure must be equal at less than 30 cm of H2O, and you can calculate this pressure from the ventilator by pressing the inspiratory pass. And you can do it Q4 hourly and anytime if you change the PEEP or tidal volume. Your fourth goal is the oxygenation goal. In this goal, you must maintain the PaO2 between 55 to 80 and SpO2 between 88 to 95. Because your fifth goal is permissive hypercapnia. If a patient, because in ARDS we set the low tidal volume that lead to the hypoventilation, which result in the hypercarbia. So in this patient we tolerate the hypercarbia up till to 7.30. Patient pH is decreased less than 7.15, then we can increase the rate, and the limit of the respiratory rate is 35. And our sixth and last goal is the IE ratio. In ARDS, the duration of inspiration be equal or less than the expiration.